Good evening. My name is Professor Wilton Alves de Freitas. I'm professor in the chemistry department at the Federal University of Paraná, and I will talk a little bit with you about my project named Diagnosis, Therapeutics, and Molecular Basis of Chronic and Neglected Disease. There is a paradox in Brazilian public health in which two patterns of health problems can be identified, both associated with problems of income distributions in some regions of Brazil. Geographically, the states located in the south of Brazil presented higher income of chronic disease as cardiovascular, cancer, respiratory disease, and diabetes. In parallel, the states of north and northwest of Brazil suffer from neglected disease as malaria and leishmaniasis, for example. The traditional methods to treat the disease are pharmacological. However, the combination of new drugs as a support to conventional treatments, reducing problems of effectiveness, toxicity, and resistance, demand alternative therapies. In this context, the use of nanotechnology could improve the drug performance, reducing toxicity and resistance to multiple drugs. A global vision of the problems needs not only new drugs, but also new bioanalytical assays to reduce the diagnostic time and the therapeutical monitoring, and a deep understanding of the molecular mechanism in chronic and neglected disease. The goal of these projects is to develop new strategies to reflect the state of art, to prospect biomarkers, methodologies of monitoring, and new pharmacological agents using nanotechnology to treat of chronic and neglected disease. The graduation programs involved in these projects are chemistry, bioprocess engineering and biotechnology, pharmaceutical sciences, microbiology, parasitology, pathology, genetic, and physiology, in collaboration with 27 international universities from different countries. The specific goals are to develop new drugs and inhibitors of drug transport involved with resistance and chronic neglected disease, to develop new nanostructured drug delivery systems to improve bioavailability, specificity, and kinetics, to establish a platform of biomarkers to develop therapeutic monitoring of chronic and neglected disease, to improve the bilateral relation between Brazil and foreign universities, promoting the internationalization, to increase the number of PhD students with international sandwich experience, to realize workshops in Brazil with international speakers, and to teach courses in English at UFPR. The justification of these projects based on the topics presented are separated in three. Scientific. The chronic disease produced 16 million of premature death, and the neglected disease affect 1 billion of humans according to WHO. To reduce the social and impact of this disease, using the expertise of national and international researchers, it is intended to develop new pharmacological agents, use nanotechnology to improve vectorization, stability, and bioavailability, identify new biomarkers, improving the diagnosis, developing the scientific knowledge in this field, the molecular basis, and providing a rational therapy. In terms of technological, it is intended to produce patents of drugs, nanotechnological systems, biomarkers, and kits of diagnosis. Economical and social, to improve internationalization using missions, visiting professors, and sandwich PhD. Also, increase the number of courses in English, propagating the Capsprint effect to other students at UFPR. To the community, we expect to generate new therapies and diagnoses, improving the people life quality and putting scientific research to the benefit of the society.